Catherine Chong here. How are you all doing? Welcome to another week of our Facebook Live show. So in today's teaching class, I'm going to walk you through what exactly is CoQ10 supplements, the what, how, and why you should consider them if you are trying to conceive. So for those of you who don't know me or who just joined our community, welcome, a big welcome and hello to our community. So my name is Catherine Chong and I'm the fertility dietitian based in Brisbane, Australia, where I currently consult to two medical centers in Brisbane, one in My Health Brisbane Showground and another one in the Star Medical Centre at Sunnybank. I also run a virtual consultation practice, which means I can see you no matter where you are from my home office. Now, I mainly work with women and couples to create a preconception meal plan, a diet plan, to help them to optimize their fertility and to work out the best nutrition plan to help them to have a healthy pregnancy and a healthy baby. So if you're interested to find out more about my service, I do offer a 15 minutes free nutrition assessment call where I take some time to understand where you are at the moment and to discuss with you what will be the best next step for you. So if you're interested to sign up for that call, make sure you go to my website, catherinechong.com.au/book a consult. That's where you can schedule an appointment with me. Now, so today, as promised, we are going to look at CoQ10 supplement. What is CoQ10 supplement? You probably have heard about it before, and the chances is you probably are also taking CoQ10 supplement. So we're going to dive into it specifically. What is the evidence and what are the different types of CoQ10 and which dose or what should you do and how long should you take CoQ10 supplement? So let's dive in. Now, CoQ10 in another terms is also known as coenzyme Q10, which is also known as ubiquinone. So basically it is a fat-soluble component, and it's an antioxidant that our body produces naturally to prevent lipid peroxidations and also the DNA oxidation. It is so important that literally made in just about every cell in our body to support as a bioenergetic molecule, empowering our body to produce the energy needs. However, the bad news, as we all age, the body may not be able to generate enough of this CoQ10, right, to make enough of cellular energy. And where can we get CoQ10? So it is common that we can find CoQ10 in food such as red meat, fish, nuts, and avocado. However, the amount of the food may not be sufficient enough to meet the increased needs of CoQ10 level, as I highlighted, especially as part of the aging process and fighting the natural free, the oxidations as well. You may require a higher demand for it. Hence, supplement is quite often considered or used, especially in the fertility treatment. Your specialist or your professional may recommend you to also include CoQ10 as a supplement. So today we're going to take some time to dive a little further into the evidence to look at specifically, is there any evidence to support the use of CoQ10 in terms of the pregnancy outcome or in terms of the egg quality, and which form of CoQ10 should you choose, and how long should you take CoQ10 supplement. So let's have a look what does the current research saying. So I want to draw your attention to quite a recent study published last year. And I should highlight that despite all the claim, there's still it is still a very early stage in terms of CoQ10 and the benefits of fertility, nutrition, and the egg health. In fact, there is very little human research looking into the CoQ10 for fertility. Now, there was one particularly study, which is the systematic review published last year. The study aimed to systematically review and meta-analyze the best available evidence, looking at the effect of CoQ10 supplement and also the pregnancy outcome. So you can say that is kind of the best type of quality of study that we're looking at. So the authors included 5 randomized control trial, which has about 449 women who suffer from infertility issues. What they did is they recruited about 200 in the CoQ10 group and another 200 participants in the placebo or the no treatment group. So the author reported that the group who took the CoQ10 supplement resulted in an increased clinical pregnancy rate, especially in women with the low ovarian reserve and who have a background of polycystic ovarian syndrome. However, though, it is important to note that even though that it seems to might be beneficial to increase that pregnancy rate, there's still no difference if you're looking at comparing the live birth and miscarriage rate. Let me have a sip of water, okay? Now, in other words, the author actually concluded that the oral CoQ10 supplementations might increase the clinical pregnancy rate, especially for women who undergone the fertility treatment such as IVF. However, there's no favorable effects if you're looking at the actual whether it will promote live birth or in preventing miscarriage. We are still not too sure at this stage, right? So which form of CoQ10 should you choose? So you probably have came across so many different brands, so many different types. So today I'm going to guide you through what exactly you should look out for. So CoQ10 generally is considered as a safe and inexpensive way if you're thinking of adding that supplements to enhance the fertility, especially if you are thinking of going through, planning to go IVF or if you have scheduled IVF treatments. So CoQ10 generally is known to have only produce a few side effects. Although you should note that if you're taking the dose too much, it can cause nausea and vomiting, right? And also a few things that you should take note. It may also interfere with warfarin and other anticoagulants medications. So it's so important to check with your doctors before commencing any supplementation. So in terms of the kind of the right dose, so the medical community is yet to reach a consensus about, okay, what is the ideal dose we should advise women to take to optimize the egg quality. It's just not enough of evidence to really make a recommendation at this stage. However, though, there is one study using a dose of roughly about 600 milligrams twice per day, which is an oil base of the CoQ10 enzyme for 2 months. So currently, most of the recommendation is still based on this study, which is also the most common recommendations of about 600 milligrams twice a day. But what is more important for you to take note, in fact, today, I want you to learn that there are 2 different types of CoQ10 and how effective the dose absorb in your body. It really depends on which form of CoQ10 you use. So if you are taking your CoQ10, make sure you go to your pantry right now, have a look at the bottle and have a look what actually is the ingredient on your bottle. Okay, so 2 types of CoQ10. The most standard or common form is called Ubiquinone. Okay, Ubiquinone. I don't know if I pronounce it right. And this form is not very soluble, and much of it is not actually absorbed in our body. So what does get absorbed then converted in the active form of antioxidant, which is called ubiquinol. Okay, so more than about 95% of the CoQ10 is in circulation is in this reduced active ubiquinol form. So when I choose say for example the ideal brand of CoQ10 for my client, I will actually specifically look at the ingredient list of the supplement brand and making sure that it is already in the active form of the CoQ10, which is called ubiquinol, which is the active form. So it just proves that it is much better absorbed in your body. It is typically though more expensive than the standard type of CoQ10. However, I should highlight that there are some brands these days do also offer unique formulations of that standard form of the CoQ10 that's designed to be more readily absorbed in your body, such as suspending in like a tiny droplet. So it really again depends on the form of CoQ10 that you're buying. You may need a different dose, and you may need to take a different time as well. So make sure, if you're unsure, reach out to your fertility dietitians to review your supplements brand for you, and again to customize an appropriate supplement regime for you. And if you're unsure, I do also offer a 50 minutes complimentary nutrition consult. So if you are interested to have a chat with me, make sure you can schedule a time on my website, so katrinchong.com.au/book a consult. That's where you can schedule a 50 minutes free nutrition consult with me. Now next, now that you understand there are different forms of the CoQ10, right? So right now, how should you take it, or what is the right dose? And again, it will be hard to tell you exactly what you need to do because it's such an individualized plan. But generally, between about 50 milligram to up to about 600 milligram is considered fairly safe, and ideally you should spread across the day. That is because it really depends on what is the dose you take at a particular time, because there's a limit of how much it gets absorbed at a time. With the percentage of absorb starting to drop, if you have taken a dose of above about 200 milligram at a particular time. So it is also not to take in particular at night, because there are some people do complain having trouble to sleep when taking at night. Plus, it's best to take it as a meal because it is a fat-soluble antioxidant compound, right? So these are the tips I can give you today. So lastly, if you ask me, should you take CoQ10? Sorry, just my throat is getting a bit itchy. So based on the study today, if you are planning to conceive, through IVF, sorry, I'll be back 1 second. Alright guys, I'm back. That's what happened on the live show when your throat is itchy. Anyway, let's finish up today's live teaching class. So, if you are planning to conceive through IVF, definitely I would suggest to thinking about to take a high dose of the CoQ10 supplement, and make sure you consider to take the most effective form of the CoQ10, which is known as the ubiquinol, at least about 3 months before your IVF. that will be ideal because it takes about 3 months to actually optimize the egg health to make sure that it's fully developed. And ideally though, something important to take note before we end this today teaching class is it's so important to actually to stop taking the CoQ10 before the egg retrieval, since the supplement is not longer needed. This is particularly for you if you are going to start the IVF treatment, because the whole idea about taking the CoQ10 is to optimize your egg health. And currently there's also not enough a study in terms of looking at the safety for pregnant women, so it is still best and advisable to stop the CoQ10 a day before the egg retrieval. Now, suppose if you are just starting to think about trying to conceive, have no issue with fertility problem, adding a CoQ10 supplement, it might be also a way to optimize your fertility, to improve the egg quality in addition to diet as well. So it might be an option for you to think about. So once again, if you are unsure what to do, make sure that you reach out to fertility dietitian like myself. And like I say, I do offer a free 15 minutes nutrition assessment call. You can schedule a sessions on my website at katherinechong.com.au/book-a-consult. And I hope you do learn about some tips on how to choose the best one of CoQ10 supplement. And I do apologize today that I actually have a bit itchy throat, just a bit of unwell. But again, I'm still stay live, and hopefully you still learn some stuff from me today. Until next week, I hope you guys had a fantastic week, and I will see you again next week. Bye for now. Have a great evening.